treatment starts with the dermatologist consulting with the patient to understand what they desire, whether it is a new shape of the eyebrow or is it something to increase the density of the existing brow. Then the eyebrow is marked out and it makes sure that the patient and the doctor are in agreement about the shape and the thickness of the brow. Then a local anesthetic cream or injection is given to numb the area of the brow. Then using a tattoo machine, the strokes of the tattoo pigment is deposited along the lines of the brow itself, making it look as if there are natural hairs in the hairline of the eyebrow itself. This treatment is usually going to take about an hour to 2 hours for the treatment to be complete, and it's more an aesthetic as well as a medical procedure because it involves the skill of the aesthetics in designing the brow and it involves the medical purpose, which is basically maintaining asepsis, making sure there is no infection on the skin so that you get the best of both worlds, beautiful as well as a safe treatment to make sure that you are looking your best.